Hi, my name is Dr. Fabian Schick. I'm specialist for biological dentistry and ceramic implants. And first of all, I have to tell you that I'm really happy to be with you all today and have to say thank you for having me there. Thank you, Analia. Thank you, Seb, for hosting this beautiful congress, Health Starts in Your Mouth. 2024, first time ever in Manchester in this upgrowing field, which gets more and more important in my point of view. And yeah, let's just jump into that lecture because I have 45 minutes and I want to give you as much information as possible, how we perform dentistry, how we try to get immunological sustainability, and how we can maybe improve overall health through dentistry. And this is why my lecture is called Immunological Sustainability, a Missing Link to Optimal Health. So yeah, let's just jump into that. And I want to talk to you about bone quality. Everybody sees that this softened bone here is obviously not healthy. It is immunologically loaded and has a lot of cytokines in there. I want to talk to you about immunological stressors. Also here, everybody sees that this tooth in the anterior area is black and is loaded with bacteria, toxins, and is sticking in your bone marrow where always the blood is built. And yeah, also here we have immunological stress. I want to also talk to you about aesthetic solutions, because this is also important for patients' mindset and patients' well-being. We don't want just to remove something, we want to rebuild in an aesthetic way, and with the right techniques, which I will all show you, we can have both. We can have the immunological release and we can have aesthetic solutions by using the right techniques, by using the correct materials. And yeah, this is actually the most important thing what I want to tell you today. And of course, we want to optimize overall health through all this by releasing immune system, by releasing immunological stress, which is in your mouth or in your jawbone. We want to optimize overall health. When patients come with loaded immune system, autoimmune diseases, chronic diseases, they have loaded immune systems. And when we release immunological stress from the mouth or from the jawbone, we can maybe optimize the patient's condition here as well. And this is why I want to talk to you about overall health as well. Yeah, and this is our Munich research team. This is where I work. I work in the practice clinic for integrative dentistry in Munich, Germany. And obviously everybody knows this guy on the left-hand side. This is Dr. Johann Lechner. He has done a lot of research about connecting oral and overall health, improving health through dentistry. And yeah, I think we all have to be really thankful about all this work he has done, drawing this red line that we all need. On the right-hand side, you see Dr. Florian Otter, my colleague and good friend. We do the daily business in the practice clinic, so all the surgeries and all this stuff. So yeah, this is me. And yeah, this is just about how I got into biological dentistry. I always was interested in optimizing health and being the best version of myself, and this is why I was not really convinced about conventional dentistry with all the root canals, all the metals, and all this was not my field. So I searched something else and found it in integrative biological dentistry, which is for me an upgrade for the conventional dentistry and not the opposite. Okay. So what if we think about what is the mindset of the next generation? So in my point of view, we are in a generational change. Everybody talks about longevity, nutrition, sustainability. Everybody tracks himself with blood pressure, heart rate variability, and so on. And everybody wants to be as healthy as possible. And the question I want to make here is, where is dentistry here? Because in my view, integrative biological dentistry has the better answers to all these words that are standing here: balance, mindfulness, quality of life, sport, performance, and so on, wellness. And yeah, this is why, in my point of view, I think integrative biological dentistry will get more and more important in future. And although everybody talks about longevity and being as healthy as possible, we have a problem because autoimmune diseases and allergic diseases increase steadily. You see that on these two little pictures here. On the right hand side you see the chronic health issues which go up and up, and the infectious diseases on the left hand side go down and down. So where does this all come from? Although we want to be as healthy as possible, the chronic diseases increase and increase. And yeah, and this is a little quote from Professor Zeltner, which was a chairman in the WHO, and he said, "We now know that many chronic diseases originate in the oral cavity." This is for me reason enough to look deeper in that and to dig deeper. Yeah, let's ask the question, where does this all come from? So can chronic stress lead to chronic disease? Can chronic immunological stress lead to chronic disease? And this is a little article about stress as a trigger of autoimmune disease. So if you are interested in going into that, you can always in this lecture just scan these little QR codes and you will get directly to these articles. So where does this immunological chronic stress come from? So you see a lot of headlines here. A few of them are out of dentistry, a few of them are from the environment. So stress is always causing dysregulation, and the task of your body is to get you back into regulation. But if the stress gets too much, the immune system cannot regulate that anymore, and maybe this is one reason for chronic disease to appear. And yeah, we can just go through. We have in the mouth, we have silent inflammations maybe. We have metals, we have composites, we have toxins, bacteria, FDOJ, epigenetics, EMF, and so on. All this is causing immunological stress. A special view on periodontitis. This is a field which is already well known, with the connection to heart disease, to Alzheimer's disease, and so on. And this is why we have to take care about inflammation-free mouth and jawbones. Okay? Let's go into how we perform that. So first we want to get to know, where does the immunological stress come from. Okay? This is how we try to diagnose immunological stress in the mouth or in the jawbone. So we call that integrative oral medicine, and we do a lot of diagnosis. So we do oral imaging, 2D, 3D X-ray, ultrasound, really important. So we can just find out where the jawbone is healthy and where it is maybe softened and loaded with cytokines. We do oral toxicity tests with root canal teeth. We want to know how many bacteria, toxins are around there, surrounding that tooth. We do immunological blood testing on different materials, on Rantis CCL5, which is a marker for chronic inflammation in your body. We do a regulation test, which is called TH1, TH2, to individualize treatment plans, and we do thioether mercaptanes in a systemic blood testing, and want to find out if there is a special immunological reaction on bacterial products that might come out from root canal teeth. So first we have to know where is the chronic stress and the dysregulation coming from. What are the immunological stresses that are disturbing regulation and homeostasis, and where is the medical indication to do something? So yeah, we always do post-surgery, we do histologies, we measure Rantis CCL5 in our probes, and we of course do imaging controls with ultrasound 9 months after performing a surgery. This is just an article that came out 2 weeks ago, and this is about how to individualize treatment plans. We therefore use regulation tests, as I told you before, and not every patient is the same. If you have chronic health issue in a patient, maybe there is a big dysregulation ongoing in this patient, and maybe we have to go smaller steps and support these patients more than others, because you can perform the surgery as good as you want. If the patient has not the ability to heal afterwards, you don't have good results and you don't help patients. This is why if we have big dysregulations, we are pretty cautious and go smaller steps and give more support surrounding these surgeries. Yeah, and with this slide, I want to tell you something about transalveolar ultrasound measurement, which is called cavitao. What you measure with the ultrasound by sending these ultrasound through the jawbone is just the bone density. You see hard and healthy bone, and you see immunologically loaded softened bone, where we often find a lot of cytokines in, and for example, anti-CCL5, which is just a marker for chronic inflammation. With this slide, I just want to show you how we measure that. You see on the left-hand side, you see this green and this red dots, and the greener it gets, the more solid the bone is. Okay, the more red it gets, the more dissolved it is, the more osteolysis you will get, and the more cytokines might be in there. And let's talk about where does this osteolytic bone, this FDOJ, fatty degenerative osteolysis in the jawbone come from? Actually, it's always the same. We have extraction wounds that did not heal properly. We have post-endodontic inflammation. If you have root canal teeth that are not immunologically neutral, bone might dissolve in the surrounding bone, and you have titanium particles coming out of titanium implants, for example, that might cause the same thing, because the particles, the macrophages try to absorb these particles, and the bone dissolves, and you will get osteolysis there. What you can make visible only with ultrasound. And let's ask the question, does this immunological stress, this degeneration, dysregulation, neuralgia, anti-CCL5, does this have effects on overall health? In my opinion, the patient is more healthy when this immunological stress is not in the mouth and not in the jawbone. So where does this immunological stress come from? So when we talk about post-endodontic inflammation, it might be a reason that you always have bacteria in root canal teeth. On the right-hand side, you see the root canal system, how it actually looks like, and it's nearly impossible to remove all bacteria out of that. So this is just a study. You can just scan the QR code if you're interested in that, where the scientists just measured how many bacteria are in root canal teeth, and they nearly found bacteria in every root canal teeth. And I just asked the question, if this is good, if when this sticks into your bone marrow, and if this sticks into your jawbone and causes immunological stress. This is also a really cool study from the LMU Munich, where they found osteolytic bone surrounding root canal teeth, although it was not visible on the X-ray. So what I thought when I read that is, hey, we see the same. they see it with the MRI, and we see it with the ultrasound. But dissolved bone osteolysis surrounding endodontic treated teeth is always immunological stress. And yeah, this is just for me, it was a good thing to read that, because this is we see the same. Yeah, and this is also a study about what might be the problem with this post-endodontic inflammation, because the bacteria that are inside this root canal system produce thioethers and merocaptanes, which are toxins and could cause a block on mitochondria, that the mitochondria cannot produce as much ATP as they would produce when these toxins were not there. And you can also scan this QR code if you are interested in that. Yeah, this is the slide for titanium implants. And yeah, we now know that even when we screw this titanium implant in the bone, particles come out of that. And the macrophages, they try to absorb it and even produce more cytokines out of that, which causes the osteolysis afterwards. And yeah, in this study, this is also from the LMU Munich, they wanted to know how much particles come out from the zirconia implant and how much come out from the titanium implant. And they found that the titanium particles were 2 times higher than the zirconia released from the zirconia implants, and the cytotoxicity and DNA damage was even higher with the titanium implants. So this is the reason, for me, I don't have to question about what is the right materials. When I read something like that, I'm just on the ceramic side. Yeah. And this is another study which show these particles in the jawbone. So yeah, and this is just what I wanted to tell you about. These particles are in the jawbone. In the jawbone there's blood, and in the blood there is macrophages, and they want to absorb all these blackish particles, but they cannot absorb everything because they're coming more and more out, and they are producing more and more cytokines out of that. And what is the result of that? You see that on the right hand side, that really connected to the titanium implant, we have this fatty degenerations, which you see in the yellowish area there. So yeah, and do we have a better option here? In this study you see the particles are coming out, the macrophages come and even produce more TNF alpha, interleukin beta, and this is causing bone resorption, tissue resorption, and this may be the beginning of peri-implantitis, which gets even more and more important. So yeah, we just wanted to know if there is better option, if the bone health is better surrounding metal-free implants. And what we found here is just that we found more healthy bone, more solid bone surrounding the ceramic implants as surrounding the titanium implants. Surrounding the titanium implants, we found more osteolytic bone, more fatty degenerated bone. You see this in this little table here, and this is why we guess that ceramic implants have an osteoimmune advantage over titanium implants. Also a big issue is the soft tissue healing surrounding ceramic and titanium implants. We know that the adhesion molecules, there's better soft tissue adhesion on the ceramic implants as on the metal implants, and this is always just closing the immunological door, because if you don't have a tight connection there, the bacteria and the pathogens will always have the chance to go through that door and affecting immunological stress surrounding your jawbone. And on the next slide, you will see a little video where I just filmed it. You see a titanium implant on the right-hand side, and you see a ceramic implant on the left-hand side. And I go with air pressure surrounding that and just try to see how the tissue reacts on this air pressure. Is not really tight on the metal, but it's tight on the ceramic. And this is why it's a closing of the immunological door and less immunological stress. Yeah, and we have to build up immunological barriers and inflammation-free tissue to have immunological sustainability. Okay. On this slide, I want to show you a little case where the patient came and always had pain on this titanium implant, but it was rock solid and nobody knew what to do. And you see this on the X-ray, that there is a little bone loss here surrounding the titanium implant, and on the left-hand side you see that there is nearly no keratinized tissue that is immunological barrier. So there were always bacteria around there, and this might cause this problem. So what I have done is to remove this titanium implant to clean out all that degenerated bone, all particles. I removed this root canal tooth, replaced it by 2 ceramic implants, and in a second step I did a soft tissue transplantation from the palatum to get this important immunological barrier, to get this situation really sustainable. And on the same point, really aesthetic, because when something is healthy, it will always look healthy. So yeah, this is just a small little video that you have seen this dissolved bone, this FDOJ fatty degenerated bone. I will not play that video on the full, but yeah, this is a little window through the bone, and now we go through there with a little spoon and try to scrape out all the degenerated bone, and you see this is not healthy, right? And in this case, this is just a not properly healed wound, and you see the fatty structure, and we always will send that to the lab and measure the Rantis CCL5 there. What we do then is to fill that up with PRF, which you see here, to promote healing inside and to get a lot of growth factors in, and of course disinfect with ozone gas and optimize bone metabolism, soft tissue metabolism with IVs. So yeah, and you can just combine these surgeries with implantation. So we want to have both. We don't want to just remove bad bone, we want to regenerate and restore on the same point. So in this little picture you see, and there was a FDOJ surgery, and afterwards when we cleaned out that bone, we disinfected all that bone, we inserted a ceramic implant here with PRF to get healthy bone. So in the front tooth area, I just want to show you how this ceramic implant is placed. This is not the normal speed we work in, but yeah, I had to speed that a little bit up to get this all done in 45 minutes. So we remove this tooth, we remove the infection here, we go in with a ceramic burr to remove all the osteolytic bone areas, all the degenerations, and fresh up that bone. This is the implant drilling, also with ceramic burrs, because we don't want to have titanium or metal particles inside the bone. This is ozone disinfection, and when we have done all this, we place the ceramic implant, which you see here. This is monolithic, this is fully ceramic, and yeah, we drill that in, screw that in, that it gets stable in the correct aesthetic positions. And afterwards, we always use our PRF to promote healing in the inside, because we want to produce healthy bone there. This is just a little suturing. The patient gets a little temp and leaves the practice in a good aesthetic. This is just procaine, Norel therapy, and afterwards we will always inject a little bit of IPRF as well to get even more growth factors and more healing in there. So yeah, let's jump into a little case how this can help overall health. You see in this picture that the patient had a big problem with atopic dermatitis all over the body. This patient was working for the television and could not work anymore because of this chronic health issue. So she went from doctor to doctor to doctor, and then she came in our office and had the question if immunological stress from the mouth could trigger her problem as well. So we just jumped into that and did the same system as I told you before, how we diagnose immunological stress, removed and regenerated that stress, and yeah, you will see what we did in the next slide, because here is another study where RANTE-CCL5, what we find often in these degenerated areas, has a connection to the etiology of a atopic dermatitis. And you see on the next slide, this was her x-ray. So she had titanium implants, she had root canal teeth, she had foreign body on the lower right, and a lot of different metals there. And what you see on the cavitar, you see this green and red dots. You see the softened bone and the hard bone, and everywhere you see these red dots. You might have immunologically loaded bone, high RANTE-CCL5, which is connected to this atopic dermatitis. And this is why we removed all this and regenerated this. This is what came out from these areas, and you see this is not healthy bone. We sent that to the lab and we found a lot of RANTE-CCL5 inside. If you compare that to healthy bone, what you see in the blue on the blue table, it's a lot more in these degenerated areas. And remember, RANTE-CCL5 is just a marker for silent inflammation. So what we did is remove silent inflammation, chronic inflammation, from her bone marrow, and regenerated with PRF, with a good bone healing protocol afterwards. So here you just can see a few impressions from the surgery we did in this case. So we removed all the immunological stress causing materials, all the root canals, and we removed the fatty degenerated bone areas, and afterwards we restored it with ceramic implants and with autologous bone augmentation. So if you want to augment something, it's always, in my point of view, the best option to do this with own bone from the patient, because also artificial materials might cause immunological stress, what we actually want to remove in these kind of patients, right? And yeah, we just use ozone, we use APRF, we use IPRF, we use procaine, we use bioinert materials to restore everything. And on the last picture, on the lower right, you see if something is healthy, it will always look healthy. And if something looks healthy, it will always look aesthetic. So this is what I want to tell you. If you use the right materials, you will always get good results in the outcome. So this is the result in the ultrasound. You see the ceramic implants on the right hand side, and we did a cavital measurement, again an ultrasound, and you see more green than red right now. So we removed immunological stress from the jawbone and regenerated in a healthy way. We are not 100% perfect. You might see in the upper right a few red dots, but this is not the issue. The issue is to remove as much immunological stress that the patient has the ability to get into regulation again. It is not always about 100%. You just have to remove as much immunological stress as the patient needs to get into regulation again. And what was the outcome with this dermatitis? You will see that on the next slide. And on this slide, you see what happened to the dermatitis, which was actually the reason why we did that all. So the dermatitis was gone for 85%, and for the patient, this was a real game changer. She was at so many doctors, at so many different therapy ways, and nothing could help her. But the removal of the immunological stress in the mouth or in the jawbone was the game changer for her. We published this article in 2022, and you can always look that all up. If my video is on a bad position right now, Seb and Analia will can give you the PDF if you want to. Yeah, let's just jump into another case where we had a problem with chronic fatigue. I told you before that the toxins coming out of root canal treated teeth might cause a problem for mitochondria and for ATP production. And when we see here that surrounding these root canal teeth, we have this dissolved bone, this osteolytic bone, this might be the reason as well. Because you see on the next slide, you see the osteolysis on the root tips, and on the blood testing, we had a immunological sensibilization on thioethers and mercaptanes in this patient. So we had immunological sensibilization, we had dissolved bone, osteolytic bone surrounding the dead teeth, and we had even on the x-ray you see this big infected granulomas, cysts, whatever. And what we did here, because the patient was also not happy with the aesthetic situation, we first did a aesthetic planning, what you see on the lower left, and then performed the surgery. We removed the dead teeth, directly replaced it with ceramic implants. The patient left the office with temps, so she had no aesthetic problems for the healing phase. And you see the situation after 4 months. And for me, this is what makes me happy as a dentist, if I see tissues like this. Okay, if you see the pink and inflammation-free tissue surrounding these ceramic implants, you know that this is sustainable. You know that this bone underneath will be healthy as well. When you have healthy tissue on the surface, you will always have a healthy bone underneath as well. And yeah, this was the aesthetic reconstruction in her case. And a case is always aesthetic when it's healthy. You know, this is you have to have both. You have to have healthy tissues that it gets aesthetic. So if you see the initial situation here, I think we got a pretty good outcome here, and the patient was really satisfied with that. Yeah, we also published this article, I think, 2 years ago. And if you are interested in reading that, just scan this QR code and you will directly go on to that. What is our vision? Our vision is to bring patients back into regulation and homeostasis. And why do we want that? We want patients to have both oral and overall health. Why? Because we want the patient to have the best possible quality of life. And this is why we all do that. And yeah, as I know we are not the majority of dentists, not the majority of the students, but yeah, I think we will grow, and this whole issue will get more and more important in the future, because we are in this generational change we talked about earlier, and yeah, we have to dream big to get this all done. You get beautiful aesthetics as a byproduct. If I can ask the question, okay, what do you think? Where's the implant here? So you can just discuss a little and maybe stop the video and discuss where the implant is. And I will show you on the next slide that it is 3 implants. It is 3 implants. And if you use the right materials, the right techniques, the right bone healing protocols, you will always get aesthetic outcomes. And this is what I want to tell you. We can have both. We can have immunological release, and we can have aesthetic regeneration, restorations. So this is not that you can just have one of that. And yeah, healthy soft tissue is a reflection of immune response underneath. So this is what I told you before. If it is healthy on the surface, the chance that it is healthy underneath is big. This is just another case where you can see why these ceramic implants are favorable. I love this case. This is a case my father sent me. He's also a dentist, and yeah, this is for me a good thing that he sends his front tooth. This was a high smiling line and a young patient where we wanted to reach the best possible aesthetic outcome. And yeah, I think if you can just ask the question, where's the implant here? Some of you might see it, but I think it's a pretty good result here, because the implant is here and you always have this pink tissue and all this papilla. If you do the immediate implantation, you will always have the better aesthetic outcome with a papilla, with a tissue, with a bone, because you have no collapse of hard and soft tissue, which might help both in an aesthetic and in a mechanically sustainable way, and also immunological sustainable way. So yeah, we have to strengthen our networks, because we are, as I told you before, not the majority. This is why we have to strengthen our networks to connect, and you can just scan this little QR code. We could connect on Instagram, and yeah, I'm happy to be in contact with you. So what are our top 3 learnings from today? Our learnings are that we have to individualize treatment plans. Not everybody is the same. We have to take care about patients' conditions, and if they have big dysregulations ongoing because of chronic health issues, maybe we have to go smaller steps to do more support in surrounding the surgeries, and yeah, that the patient has the chance to heal. Yeah, we have to identify the immunological stress with the right tools. In my point of view, this is ultrasound, CBCT, of course, blood testing. And we always have to take care about medical indications. We cannot have the mindset, okay, metals are always to remove and root canals are always to remove. You have to have a medical indication for every step you do. And this is why you have to have the correct tools, and yeah, this is really important. And yeah, use biocompatible materials and minimally invasive surgical techniques to get both sustainable and aesthetic solutions. And this is my last slide. I want to say thank you. This is my email address if you have any questions. This is also, again, the QR code for my social media. And yeah, I would love to see you in person. I promise that I will be there in person next time in 2025 for the Health Starts in Your Mouth Congress in Manchester next year. And enjoy your first ever Health Starts in Your Mouth Congress in Manchester. This is just a picture from me and Seb when I visited him, and we did a little ceramic implant training. We do a planning right now. Maybe I will come over in the next few weeks again, and it was always fun to work with him, to work with you all. And yeah, want to say thank you. Have a nice congress. It was a pleasure, and see you soon. Bye.